I'd love to touch on this subject from you, because I have two daughters and you helped me to think through this. So career advice for a female recent college graduate who wants to work in health IT and eventually be the CHIME CIO of the year. What career advice are you giving that person?
Well, career advice. As early as you can, find role models and mentors. You know, that's important. I really like the article, The Confidence Gap, that was in the Atlantic in 2014. I've used it in some of my presentations. It's a lot of data. It's quite a long article, but I think it helps everyone, women in particular, frame some of the issues that women face around confidence. And I would also emphasize that there is no right path, and the choices that you make are your choices, and they have to be right for you and your family. So, you know, it's your path in the long run, and don't let anybody tell you what that path needs to be.
You know, the one thing I've been talking to people about, and I forget who was on the show that we were talking about this, but it's interesting that when a female executive and a male executive look at the role of the CIO, the male executive just says, well, I have 2 of the 10 qualities. I'm pretty sure I could do the job. Where a female goes, well, I only have 6 of the 10 qualities. I need to develop the other 4 before I can do the CIO. And it's such an interesting mind gap that somebody who has 6 of the qualities and somebody who has 2, the person who has 2 thinks they're more qualified than somebody who has 6 doesn't think they should put their name in the ring. And we almost need to keep encouraging people to say, you know what, let someone else, if you want the role, let someone else decide you're not ready for the role. Put your name in there.
Yeah. What'd you say? What's
your question there? Just put your name forward. I mean, it's like,
right. I totally agree. And the article, The Confidence Gap, and I think there's a book too, gets at a lot of that from a data and research perspective, but also how women need to put themselves forward and overcome that, and that they can.